right, health insurance today on radio is the program. The program educates and brings you the latest information on everything health insurance. This program is brought to you courtesy A-Star Communications Limited, and I am your host, Taiwo Barua. Last week on the show, we discussed the topic why laboratory tests are important in your medical care, during which a medical laboratory scientist enlightened us on the important role that laboratory tests play in quality healthcare and how having a health insurance plan can help to have affordable access to quality medical laboratory and diagnostic tests. All right, as always, we thank you for your calls and feedback and inquiries about that episode, and we hope you learned one or two from that edition. On the show today, we shall be looking at the topic diabetes, management and prevention. And of course, understand what diabetes is, how it can be successfully managed and prevented. Our guest is right here in the studio to enlighten us on the topic. Remember that you can be a part of a conversation by calling or sending a message to us. Of course, to call in on the program, you can. Before I carry on with the conversation today, that's talking about talking about diabetes. Of course, health insurance has a potential of significantly improving, chronic disease management in Nigeria by reducing the financial burden on patients. Did you know this? Okay, so stick around for you to, get to know more about all of this. If you have that thing you're managing, you're hypertensive, you're diabetic, and, a couple of other ailments that, we manage as humans, this is the time for you to connect with us on radio. You might just think, oh, it's just for me to take maybe like 10,000, 15,000 naira to the hospital. But guess what? With health insurance, you will be paying lesser, right? You can save yourself that, if not half of that money, right, to do some other things. All right, totally. Okay, so this is the time to connect with us on Radio Lagos, Nigeria. The program is Health Insurance Today. You sound really well. Come on, I really want to tap into that.
I'm just trying to be like you.
I just want to be well.
You
like
are
that.
my inspiration.
All right, then. Good to have you in the studio, Doctor.
Thank you.
All right, let's get down to business now. Tell me about diabetes. We're talking diabetes today, management and prevention. Before we now narrow it down to how health insurance can help in cushioning the effect of the financial burden on some of these ailments.
All right, so let me start by talking about what diabetes is not. Diabetes is not sugar.
I was going to ask.
Yes, diabetes. What's diabetes? Sugar.
Okay.
When you sugar no man far.
So what causes it?
No, so before we talk about what causes it, what is it?
Okay.
So diabetes is a problem. I want to give you the semi-technical definition first.
Good.
Diabetes is a problem with the way the body processes carbohydrates, protein, and fats. I'm going to say that again. Diabetes is a problem with the way the body processes carbohydrates, protein, and fats. But it is characterized, how you know that this is diabetes, when there's high level of glucose in the blood. So I'll say that again. It's a problem with the way the body processes carbohydrate, fats, and protein, characterized by elevated blood sugar levels. But this is because there's a partial or total lack of something called insulin in the body.
Okay.
The problem of diabetes is insulin. My favorite metaphor I cannot use here, or let me say it's not as apt here, so I'll use a different one.
Okay.
Glucose is the currency of the body. The money the body spends to transact, to do everything you can see is glucose. You can think, it's glucose.
Okay.
You can walk, it's glucose.
Okay.
Glucose is the currency of the body. And so it sounds paradoxical that you have high blood glucose, but the person is not well. That's because it's not the blood that needs the glucose. It's the cells that need the glucose.
You're going to have to break all of these things down.
Absolutely. That's why I'm here. It's the cells that need the glucose. So you can think of it as, it's not, the bus stop doesn't need people in traffic, from the context of traffic now.
Sure.
what we need is vehicles to take people. People need to be in their homes or in their offices. The road is not the destination of people. And so when there are a lot of people on the road, there's a problem. When a lot of cars on the road, there's a problem. Cars are supposed to be transitory, and they're supposed to be carrying people or things. So when there are a lot of people and things on the road, there's a problem. And so that's how diabetes is. There's a lot of sugar in the blood. Blood is not the destination of sugar. Blood is a transitory medium for sugar. And so the problem in diabetes, if I want to use the traffic metaphor again now, is that there are not enough vehicles carrying people to where they're supposed to be going.
Okay.
There's not enough insulin.
Yes,
to drive the sugar from the blood into the cells. And so what's happening is a paradox where there is starvation in the midst of plenty. And so there's a lot of sugar in the blood, but there's not enough sugar in the cells. So the cells are starving, the person feels weak, the person feels sick. And now, so there's so much available, but there's not enough available at the same time. And then one of the ways we know the symptoms of diabetes, in fact, anyone who is diabetic, who has ever been told that their blood sugar is high, one of the ways you know your blood sugar is high is that the person is often urinating a lot. And why is that? You can think of it as if you want to wash a pot, for example, and you don't have enough soap. One of the things you can do is just put water. Now, because high levels of sugar in the blood consistently is dangerous to the body. There's a Yoruba saying that if one is long in the place where they pass feces, that different kinds of flies will come. Yes, yeah. And so what happens when there's too much sugar in the blood is the blood now becomes a fantastic space for all sorts of infections
to thrive.
And yes, so we say diabetes itself is an immunosuppressive state.
Okay. Before I allow you go on and on with all of these medical terms, and then we'll start having to break it all down. You talked about that already. So let's talk about some of the causes of diabetes.
Yeah. So there are two kinds of diabetes.
Okay.
But before we even talk about that, one of the things I need to mention is that diabetes is a chronic illness. Diabetes, I'm going to say this for those at the back that cannot hear.
Because we have a very short
diabetes
time frame.
Does not go. We do not have a medical cure for diabetes.
So it's not curable.
Yes.
Okay.
So the causes of diabetes, that depends on the kind of diabetes. That's the other thing.
Okay.
There are two kinds of diabetes.
Okay.
One that typically happens to younger people, and one that happens to older people.
Okay.
Yes. Type 1 and then type 2 diabetes.
Okay.
Now, type 2 diabetes is the more common one, so let's focus a bit on that. All right. Type 2 diabetes does not have a single cause. It's multifactorial. There are many different things that lead to type 2 diabetes.
So walk us through some of these things.
So number one is, so one of the commonest ones is in summary, it is insulin resistance. When there are plenty vehicles on the road, but all of them are broken down. Therefore, there are too many people at the bus stop. Even though there are cars on the road, those cars cannot take people to their destinations. Even though there are buses on the road, they cannot take people to their destinations because the buses are not working well, or the cars are not working well, using the traffic metaphor.
So that's the insulin now, right?
Yes.
So how do we work on this insulin?
Yeah, so causes of insulin resistance.
Yes.
There are different things. One part of it is genetic.
Okay.
If either or both of your parents have it, it's almost inevitable to have it because of other things, which are the lifestyle, God forbid.
God, why?
Because of other things. And what are these other things? For example, some of these other things are lifestyle choices.
Okay.
And so one of the things we say in the mind of diabetes, it's not just about using your medication. It's about adjusting your life. Diabetes is a life-defining ailment. It means that you're going to make certain permanent adjustments to the things you do and the things you don't do.
Okay.
We're not going to talk about cheating today, but there are ways to cheat. But I didn't tell you that. It's not me that said it. But diabetes...
We all cheat, actually.
So essentially, lifestyle choices. So reducing your intake of refined sugar. Refined sugar is anything that is sweet that came out of a factory, as opposed to natural sugars, which is things that came out that like in nature are just sweet naturally. And that's the other thing too. It's not even about sweet. Sweet is not the same thing as sugar.
Okay.
Sweet is not sugar.
I'll allow you. To speak more on that. Quick talking about sugar being different from
Sweet.
sweet.
Sweet doesn't necessarily mean sugar.
Tell me about this.
Okay, so there are a lot of things that are sweet. So, for example, sweet potatoes are very good for people who are diabetic. Yes, it's one of the paradoxes of life, because what makes sweet potatoes sweet is not a kind of sugar, and the problem here is sugar. That itself requires an entire conversation.
We have information explosion on the internet.
Yes,
and you get to see a whole lot of things about, sweet fruits like pineapple, the likes of bananas, and they tell you, okay, so you need to slow down your intake of all of these things.
That is true.
Okay, tell me.
That is true. So diet, when we're talking about diet and diabetic diet, one of the things we talk about is sweet foods tend to be more sugary, but not every. So sugar is sweet, but sweet is not always sugar.
Okay.
Almost every sugar is sweet.
Yeah.
But not every sweet thing is sugar.
It's sugary.
And the problem is sugar, which is why we just say go and have a conversation with your dietitian and with your doctor if you are diabetic, so that we can take care of you properly.
Okay, so a question just crossed my mind now. Is there a way you can balance your sugar intake with some, bitter stuff? Not necessarily the bitters they sell on counter. It could be veggies, it could be anything.
Yes.
Can you balance it?
And that's the misconception, because people think it's sweet versus bitter. No, it's sugar versus non-sugar.
Okay.
Yes. So it's not about it being sweet. So taking bitter cola, for example, is not bitter cola is not the answer to diabetes. That's just going to help your tongue. Your tongue is not the problem. Insulin is the problem. It's like somebody saying, "Oh, there are so many people on the road. So let us."
So how can one boost the insulin? Let's get down to that.
Yes. So insulin itself. So if the pancreas, so insulin is produced by a part of the body called the pancreas, and the pancreas itself, if not destroyed or not affected, can, in some rare cases, recover. So what happens essentially is that the body's production of insulin tends to reduce with age.
Okay.
Especially people who are diabetic. And so where it was producing 100 before, let's say you need 100 units to break down sugar properly and for correct flow.
Yes.
If people who are diabetic, they can't produce 100. They can produce sometimes, depending on the degree of diabetes, some are producing 80. And
Fair enough.
Some are producing 50. Some are producing 30.
Wow.
Now, for those who is like 70, we can still give them. So the tablets we give, when we give tablets as treatment for diabetes, the idea is to flog the pancreas and make the 70 do the work of 100. But we can make 70 people do the work of 100 only so far and only for so long before they break down.
True.
But when it is producing like 30, you can't make 30 people do the work of 100. So those are people that now need injection.
Okay.
The injection type, and we bring insulin from outside, so we outsource the insulin deficiency, as it were. And so, but you see, when you do not take sugary things, excessively sugary things, as someone who is diabetic, what you do is that you preserve the life cycle of the pancreas that produces the insulin.